Hey everyone, welcome to Yoga and Chinese Medicine with Dr. Spencer. I'm Dr. Spencer, and this video is the foundational baseline of yogic breathing, which needs to be understood, practiced before moving into more advanced yogic breathing, or breathing techniques such as alternate nostril breathing with retentions, alternate nostril breathing with ratios and retentions, alternate nostril breathing with ratios, retentions, and locks. Learning how to do this particular exercise is important because otherwise, as you progress into those others, without the proper foundation, basically tension can accumulate in the wrong places. That's not to be doomsday or blah 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 blah. It's just simply to point out that while what you're about to go over is probably going to seem like painfully simple and straightforward, sometimes something simple and straightforward can be profoundly illuminative and beneficial. So just keep that in mind. And I'm mostly speaking to people who, when are first introduced to this exercise, kind of reacted like I did at the time. I was like, that's silly. Well, whatever. Just do what I did. Get over it. Not to throw stones. Sorry. But essentially, the initial breathing exercise of yogic breathing is what's called a three-part breath. The three-part breath is taking the movement that occurs with a full inhalation and exhalation and breaking it into three individual parts. The individual parts are largely a fabrication because when you're doing the full breathing exercise, there is no divisiveness. One flows right into the other on the way in and on the way out, and they become one cohesive unit, hence the yogic breath. But it's helpful to have things in chunks, okay? So the three parts are the abdomen, the lower ribs, and then the chest and collarbones. Essentially, in my experience, a lot of people, we tend to breathe up here, maybe a little bit down here, but we very rarely use all three parts. So we're going to start at the bottom. You should notice a difference right away. You will notice that I'm in a seated posture, mostly for the purposes of instruction. You absolutely may lay down in Shavasana if you've watched the Shavasana video, and lay in that posture and practice what we're about to go over in that posture. That is great. That's how I practiced it for a good while. So feel free. So establish a comfortable posture, laying on your back, sitting down, whatever you prefer. Rest your hands on your abdomen, maybe close your eyes, hands right at the region of the navel. Whole body is relaxed. And start to breathe and feel the movement of your abdomen. As you inhale, feel your abdomen expand. And as you exhale, feel your abdomen contract. Don't try and make it bigger than it is. Don't try and make it smaller than it is. Just let yourself breathe and be aware of the movement that is occurring at that spot, okay? Taking a few breaths, focusing on that movement. Recognize that the primary driver of respiration or breathing is your diaphragm muscle. When your lungs are empty, your diaphragm is at its most relaxed and it's actually moving up towards your lungs. As you inhale, the diaphragm contracts, moves downward, which is what causes the abdomen to expand on the inhalation. A bigger expansion is not a better expansion. Okay? After a few breaths of that, let that go. Take your hands now to the region of your lower ribs. Try and minimize, just for the moment, the movement of your abdomen. The way to do that is to just very slightly tighten the abdomen, almost like you would if you were doing boat pose. Again, it's in the Shavasana video. Just very lightly, just to kind of limit its range of motion. Hands here, abdomen tight. And breathe and focus on the movement of your lower ribs and your hands here. Couple of breaths. You might notice that when you focus on the lower ribs, the movement of your breath seems more lateral or expands out to the sides, as opposed to when it's on the abdomen and the expansion is a bit more forward. Totally fine. That's totally normal and kind of to be expected. No points for it being bigger, no points for it being smaller. Nobody gets graded on these things. Just close your eyes and breathe. And one more breath, focusing on those lower ribs. Slightly tight navel. Good. And then lastly, focusing on the chest and the collarbone. This one you'll notice your breath will innately be shallower. That's to be expected. Slightly tighten the abdomen. Gently just stabilize the lower ribs, and think, a way to think about it is lifting your collarbone up and down. Couple of breaths. If it feels like this breath is very deep, maybe take one hand towards your lower ribs and one hand towards your abdomen, and see if you are expanding either of those areas instead of just breathing from your collarbones. Good, and then let that go. If that felt very shallow, chances are you were doing it right. The moral of that particular story is that we don't want our breath stuck up here. There's actually a lot of respiratory illnesses that can present themselves due to shallow breathing, whether they be chronic or acute. It's a whole nother story, but there's frankly a lot of health benefits purely for your respiratory system to get your body used to taking longer, deeper breaths. So the practice of this is now going to involve combining those three together. And since you did each one individually, recognize the abdomen will likely move the most, then followed in second by the lower ribs, and then third, your collarbones will move the least. And that's okay. If you find yourself seemingly gasping or anything like that, just take your foot off the gas for a second, just relax. Don't worry about having a deep breath. Focus on the expansion of all three parts and the contraction of all three parts. Okay? So let's try that. Closing the eyes if they've opened. Sinking into your seat or into your floor as you're laying, whatever position you're in. And then from your abdomen, start to inhale, feel your abdomen expand. Notice if you start to feel your lower ribs expand. And then notice if you start to feel your collarbones lift. And then let the collarbones sink. Lower ribs come in. Navel move back towards the spine. And let's repeat that a few times. Navel, lower ribs, collarbone, collarbone, lower ribs, navel. Notice where your mind is. Notice if there's any part of the breathing that is easier to feel and parts that are harder to feel. And then let your eyes open if they were closed. And one final thought. We take many, many breaths in a day, just as like we take many steps in a day. And throughout your day, you don't need to take the biggest possible steps that you can, or the deepest possible breaths that you can. But in the context of practicing breathing, practicing yogic breathing, set a timer for 10 minutes. I would suggest a timer that isn't like your alarm clock, something that when it comes on is a little bit gentler, because you might be quite relaxed and you don't want to wake up out of it. But anyway, set a timer for 10 minutes, close your eyes, focus on your breath, the three parts of it. Like the blooming of a flower, you don't need to force it to be deeper. Again, going back to our sitting posture exercises, remember, there's a difference to tell your body you can breathe deeper versus you must breathe deeper. Just practice the full extent of your breath that exists without strain, and do that for every day about 10 minutes, and over time your breath will naturally be deeper, be stronger, and include the more all-encompassing range of motion of your ribcage. Okay? A lot of talking about breathing, but breathing is integral to your health, your wellness, and in many ways, our peace of mind. So, any questions about this, feel free to ask. Don't hold back, but be kind. And yeah, remember again, these practices are simply here to remind you that your soul is whole and complete, just as it is. I'll see you next time.